Welcome to this discussion about the implementation of orthopedic patient educational materials at HOPES, the free clinic run by EVMS students.
The HOPES Clinic exists to meet the needs of underinsured people in the Hampton Roads area. Within the HOPES Clinic, we run many subspecialty clinics, including the Orthopedic Clinic, where we are trialing this implementation of patient educational materials to augment patient understanding and participation in their treatment plan and recovery. Patients' health literacy is often overestimated by physicians, more so for patients who identify as African American than for those who identify as non-Hispanic whites, which can further healthcare disparities. To prevent deficits from physician overestimation of a patient's reading level, informational handouts can be used to supplement a patient's understanding or memory when the visit is over. Informational handouts and print resources have been shown to augment patient recall. However, handouts must be written at a reading level that is efficacious for patients of the lowest literacy levels and should be accompanied by illustrations to enhance understanding for patients who are functionally illiterate. This project sought to evaluate the reading level and overall readability of existing orthopedic patient educational handouts for the most common orthopedic diagnoses, with the goal of finding handouts that would be suitable for our orthopedic clinic at HOPES. The diagnoses for which handouts were sought are listed on this slide. Google and Bing searches were conducted to establish an extensive list of handouts for these topics. Handouts were included in our analysis if they were available as PDFs to be used by the public. The reading level of each handout was determined using an average of the 3 reading level analysis tools seen here. As reading level analysis tools have been criticized for their simplicity in analyzing the brevity of words and sentences without considering the context or formatting of the article, we also performed a holistic analysis of the formatting of articles. This was performed using the Agency for Healthcare Research and Quality's Patient Education Materials Assessment tool. Patient handouts found to have an average reading level less than 7.0 per the recommendations of the AHRQ, and a PEMAT score greater than 70% were included in handout selection to be provided to patients. Our analysis did not yield a suitable handout for each topic, so handouts were developed for the remaining diagnoses. These handouts were developed using the PEMAT as a guide and underwent multiple reading level analyses prior to finalization. All informational handouts were then translated into Spanish.
A total of 57 unique handouts were identified within the 11 categories. 9 articles had reading levels below a 7.0 grade level. Of these, 6 articles met the criteria for usage when overall readability via PEMAT score was considered. 1 regarding pes planus, 2 regarding plantar fasciitis, and 3 regarding low back pain. 3 of the 6 articles were included in our final selection of patient handouts, 2 pertaining to low back pain and 1 regarding plantar fasciitis. The article regarding pes planus that met criteria was for pediatric patients, and as our primary patient population is adult, we opted to develop a handout that addressed pes planus in adults. 3 articles regarding low back pain qualified, so the one with the lowest PEMAT score was excluded. Finally, the plantar fasciitis article with the highest PEMAT score was also selected.
Handouts were developed for the remaining pathologies, and you can see the example handout on this slide here. All the developed handouts have a PEMAT score of 77%, as the same general template was used for each pathology. To ensure materials were easy to read, subheaders, bullets, bolding, and italics were used as can be seen in the example. The PEMAT score could be improved by adding more illustrations. However, for brevity's sake, only 1 or 2 illustrations of the anatomy and pathology were included per handout. The average reading level of developed handouts is 6.1, with the flat foot and wrist pain handouts having the average lowest reading level at 5.6, and the shoulder osteoarthritis handout having the highest score of 6.8. Handouts were developed with overall readability in mind and contain basic anatomical and pathological information as well as personalizable treatment checklists.
Future goals are to evaluate handout efficacy through patient surveys. Additionally, we hope to expand our selection of pathologies with handouts available so that this tool can be available for all patients. I would like to thank my colleagues Nathaniel Smucker and Rachel Schulmeister, who are also HOPES Clinic members and who worked on developing this resource. Also, a very special thanks to our mentor, Dr. Raki, who volunteers her time as an attending for the HOPES Orthopedic Clinic.